everyone, welcome to an exciting episode of TheShreeChannel. Today we'll have what's happening, the news, and Heroes Amongst Us, our very first interview.
In Atlanta, New Year celebrations continued with Gudi Padwa program by Maharashtra Mandal Atlanta. The occasion was celebrated with Maharashtrian food and decor. Niche Entertainment gave tribute to A.R. Rahman through Dil Se concert. IACA brought together top-notch artists, dance institutes and local organizations together in a program called Rhythms of India. Various classical dance forms and folk dances were presented. Notable artists such as Amol Khanapurkar, Anirban Bhattacharya, Chandrachud Bhattacharji, Anurag Sharma performed. Nabila Islam, a member of Georgia's State Senate, attended as a guest of honor. This month, Chitra Banerjee, author of Palace of Illusions, Ami Ganatra, author of Mahabharata Unraveled, and Ram Madhav, author of Uneasy Neighbors, visited Atlanta. They shared their thoughts and books with fans.
Now, coming to Atlanta,
Future Tech Vibha Champions Cricket Cup finale on May 5th. Kurra, a Marathi comedy by Kallol on May 5th. Choose Happiness, a lecture by Didi Krishna Kumari on May 6th.
May 7th, 5K walk run to honor mother by Sari Tisoots.
An Evening to Remember by Rahul Ravel on May 12th.
May 14th, Remembering Legends program by Mandar Apte.
Bismil Ki Mehfil, a program presenting Sufi, folk and Bollywood songs on May 14th. Mughal-e-Azam, a spectacular musical play on May 26, 27 and 28. Aamne Samne, Marathi play on June 10th.
Welcome to TheShreeChannel. My name is Shreya Diskelkar, and in today's segment, Meet the heroes amongst us. We have two distinguished women who've done some phenomenal and impactful job and work in the area of science and technology. We'll have a dialogue with them and get to know them better. So here we have Dr. Sweta Sneha and Dr. Kashmira Date. Welcome, ladies. Dr. Kashmira Date is the Global Medical and Scientific Affairs Lead for Vaccines with Johnson & Johnson. Prior to joining Johnson & Johnson, she was a Senior Medical Officer and the Technical Lead for Global Immunization Program at CDC. She almost worked there for 12 years, representing CDC on a global expert committee and forums. For over 6 months, she was on CDC's COVID-19 Response Task Force, leading CDC's international efforts on epidemiology and disease surveillance and vaccines. In 2017, she was awarded the Presidential Early Career Award for Scientists and Engineers by Obama administration, one of the highest honors by US government. In 2020, she was selected as one of the first women leaders for Women Lift Health Leadership Journey by Bill and Melinda Gates Foundation. Kashmira was also selected as the 2022 Women of the Year in Science by Women in Technology for her work on global immunizations. Wow, what accomplishments and accolades, Kashmira. Dr. Sweta Sneha is the Executive Director and Professor at Kennesaw State University. She is the founder and lead architect of their healthcare management and informatics system. She brings over 2 decades of experience in healthcare and technology and is passionate about digital healthcare transformation. She collaborates with healthcare experts to create innovative and scalable solutions that enhance patients' healthcare journey and outcomes. She is the recipient of the Titan 100 Award and Women in Technology Award in 2022 for demonstrating exceptional leadership and vision. She serves on the board for Technology Association of Georgia, is on the editorial board of Health Systems Journal. What a pleasure to have you both on the panel today. So Kashmira, what inspired you to switch your career from clinical medicine to public health and then to global health?
So, Shreya, I first started with this because I was exposed to this field by my husband, who actually jumped into public health when nobody else was pursuing that career. It was through him that I was exposed and introduced to the various aspects of public health. I saw public health in action, and that's what has continued to inspire me. And then I've forged my own journey through this, and it has continued to inspire me since then.
Sweta, you were with PricewaterhouseCoopers doing management consulting. What inspired you to actually make the switch to academia and to get involved in digital healthcare transformation?
So this was back in 1999 when the first IOM report, the Institute of Medicine report, came out, and that was essentially talking about how the report was called To Err is Human, which essentially said that there were almost 100,000 deaths that would happen in the United States alone due to preventable medical errors. And there was also the time when there was this little girl called Hosie King, and I was in Washington, D.C. back then. And she was admitted at Johns Hopkins because of small burn injuries. And she died in pediatric ICU, not because of anything that the physicians did, but really because it was a lapse in communication. There was a drop in the ball with processes, and that couldn't have continued. I wanted to become a student of processes in healthcare, really wanted to see how technology can impact transformations, because none of the physicians, none of the clinicians wake up any morning and want to go out in the world and want to make a fatal error. It happens because of lapse in communication and processes that were not communicating well enough to each other. So that's how I made the switch to digital health, and I came to Atlanta from Washington, D.C. to pursue my PhD and then go on to the route of academia.
That's wonderful, Sweta. What a bold and an eye-awakening experience that must have been. Yeah. Wow. STEM professions and leaderships are often male-dominated. So what is the message or advice you would give for the young women and girls out there who want to kind of, overcome these inequalities that they face?
Absolutely. I think if you look at the statistics, they are very, very stark. They show how these fields are so male dominated, and it's becoming really challenging for women to pursue, because I think there are some of these stereotypical gender biases and areas in which there are women are not traditionally encouraged to be a part of. So I do feel like, especially for young women and girls who are now entering into this area, the key thing to remember is, first and foremost, find your passion. If you're really passionate about it, do not give up. These things take time, perseverance and patience is extremely important, but your why is equally important. If you know your why, if you're passionate about it, there will be, plenty of opportunities for you to follow. How do you do that? Make sure that, you surround yourself, find like-minded girls, find the right kind of environment that will encourage you. Start at home. Find not just the like-minded girls, but also male allies, with your brothers and your fathers and your uncles, and within your community that you're in, try to find ways in which you can influence things. Find those role models in your everyday life, people who are doing these things, and you cannot be what you cannot see. So I would really encourage you to start looking at that. And I really think that some of these things, in terms of patience and perseverance, do not let setbacks set you back. So make sure that, if your passion, your why is clear, you will find the path.
That's amazing, Kashmira. What a good message for the young women and girls out there. How are you investing in the next generation of leaders and innovators?
So if you do not see enough women in leadership and there is no gender equity, we are not going to be able to change the fabric of the society right now. So one of the things that's really important to me is to make sure that we have enough representation. There are so many times when I have walked into a board, and I sit on multiple boards, yet the first time that I walk into a board meeting, my position is immediately marginalized because there are very few people, if any, that look like me. And I want to be able to change that for the next generation, for our daughters, and for the people who follow us. So one of the things that I have done almost deliberately, very structured, is to ensure that the digital health informatics program, or the healthcare management informatics program that I lead, it's an executive premium program, the only one of its kind in the state of Georgia. That program, despite of the heavy informatics, analytics, and management focus, has seen a parity in gender. And we almost have a 50% representation. Sometimes it's 51%, which is a really big feather to us, because that didn't exist before. Plenty of those girls and women have actually grown up, and they're sitting on boards. They are coming back and becoming sponsors to our program, to our students who follow in their paths. And I want to continue to invest in them through fellowships, through industry support, through sponsorship, and the others.
So what a fantastic journey you've had. What would be the most rewarding and challenging parts of your journey so far?
Let me start with the rewarding part first. So I think in terms of the rewarding part, it's really the impact that my work has on the health of populations overall. So as you know, I work very closely with vaccines. It's one of those areas that are the most cost-effective interventions that have ever been, established, right? So when I see, when I work with partners, when I work with a lot of colleagues in putting these programs in place, what we call as the lab to last mile. So, when something is being developed in the lab, and then when it gets to that last mile, when it gets to, the shots in arms or the vaccines in kids, I think it's just a very different level of satisfaction. And when we look at some of these numbers, right, like when you have something that has been shown to be effective, these are very well tested, shown to be safe and effective, and then when you look at the impact in terms of the number of infections prevented, in terms of number of deaths prevented, I think it's very, very rewarding. In terms of now the challenges. So, I think as Sweta was saying earlier, no matter where you go, as when you start rising up in these leadership chains, there are very few women up there. And so to get your perspective heard, to get your voice heard can be quite challenging.
Oh, of course.
And so, that has been the case for me as well. And so, but again, trying to work with allies, trying to work with partners, that's been getting me to where I am right now.
Awesome, Kashmira, great, good to hear that. And Sweta, I would actually direct the same question to you.
So when we launched the program, this program was really launched to fill in the gap in a workforce that could meet the demands of the 21st century healthcare and practice, because healthcare, I wouldn't say shifting, but it was morphing into a place where technology was becoming more and more center stage to the delivery and practice. And we didn't have the workforce that could support that growth and that could support that shift. So it was born to fill that gap. And right now, Atlanta is, I sit on the board for Technology Association of Georgia Digital Health, on Tech Alpharetta, on the Biosciences Leadership Council at the Atlanta Chamber of Commerce. And that time when we were thinking about it, Atlanta had sort of plateaued in terms of economic and workforce dev. And with some of that efforts coming forward, Atlanta right now ranks as one of the top places for health IT. We actually celebrate health IT, Atlanta is the health IT capital of the nation every year in Jan, and really proud of that. Because of the program has a footprint of almost 250 plus people in that workforce, and really proud of our impact on the workforce, on the economic dev, and the kind of companies that we've been able to root. A bunch of startups, a bunch of large organizations, health systems, payers, health tech companies, and so on and so forth. Of course, we have the big players in public health that Kashmira was talking about, CDC being here. So we have been able to have an impact on the workforce dev and the number of people who really go through the program. So it's one thing to be able to have an impact on the organization. It's extremely rewarding every time you shake hands of people who are walking the stage and their dreams are taking flight and they are getting into positions which they wanted to get to but didn't know how to. So extremely rewarding journey with that. The challenge is, of course, the fact that informatics and health informatics is still new. It's still in its early stages. So when we are working with partners, and we have a very strong board of advisors ourselves, but we work with our industry partners in understanding the gap, in understanding opportunities and in understanding challenges. And then I put teams of faculty and students to really address those challenges and come up with solutions. That is a challenge and an opportunity, if that makes sense, because this field is so new. Even when you're talking to the domain owners and the experts, it's really hard for them to outline what the actual opportunity and challenge is. So we have to really dig deeper and then to bring in the expertise to come up with solutions that are going to be relevant and impactful. Yes, that's, I would say, a challenge and an opportunity at the same time.
That's wonderful to hear, Sweta, and especially that, Atlanta is actually the health IT hub and is doing and flourishing so well.
It is.
So good to know. On a lighter note, Kashmira, share a fun experience with us.
Lots of them actually, which is why, Shreya, I keep going in this field. I remember there was this program that I was launching in India, which was the first time in the world that the typhoid conjugate vaccine was being introduced in this local municipal area. And I was there just sort of with our partners trying to launch with the government and with the World Health Organization. And I had like these little kids who came to me, and it was so endearing that they, especially like these little girls coming to me and asking me, because I look like them, right? And they look like me, and so for them to feel encouraged and inspired, they came to me and they were like, oh, I want to be a, तुमच्या सारखे doctor व्हायचं आहे, which is, like I want to be a doctor like you who's doing these things. And to me that was just so fun to hear, just so inspiring to hear.
On a lighter note, Sweta, what are some of those fun experiences or maybe a few fun moments you'd like to share with us?
So I'll start with very early years in academia. So that's when I was really just starting out as an assistant professor on the tenure track, and I was teaching my first class in a graduate program. And of course I was there early, and I wanted to make sure the technology works, because we all know technology can fail us. So I was there early and I was setting up things, and then the executive class sort of started to come and fill the space. And one of those were probably a senior exec, and he saw me fiddling with technology, and he was being really kind, and he walked up to me and he goes, can I help you? Are you the new GRA? Do you need any help? I'm like, I was ready for everything else except for that question, and I think I was dumbfounded, and I'm like, no, I am actually the faculty teaching you, and I think you almost failed the class. So I think he was just as stunned as I was. So that was funny to me. Many of them have supported me over the years. Many of them are the reason that the program is so successful. That when you rise, you are being held up by a lot of giants, and those are the giants who are holding me high and who have been my ally till date. And really fortunate to have them through my journey and in my life.
Wow, wonderful. And thanks so much, ladies, for sharing some of these fun experiences with us. Kashmira, you travel a lot, and how have you been able to manage the work-life balance? I'm sure a lot of young women and girls out there would be interested to hear from you.
I mean, first off, let me say it's extremely hard, but I also have all of that support system that makes it happen for me, right? Well, first off, let me say that I think there is no balance. I think I would be kidding myself if I said, yes, I have a, decent work-life balance. I don't. Because, I mean, often in your career, you will see that things are always tilting one way or the other. It always depends on what are the priorities at that point in time, what is really important, and how you can negotiate that to where you do not want to be in a place where you want to regret those decisions later. So to me, I think it's always been that. I found my the scale has been tilting every time, whether it's depending on where I am, professionally or personally.
100%.
And but I do feel like what really helps me is having that sort of support system, people who truly believe in me, and they're not just there for me when things are great, but are there for me when things are not great. And I think that's what really matters. So, I would be, I should really, thank my family. I mean, I have a tremendous partner, my husband, who truly treats me as his equal. My parents, who've always been there to support me. My friends, some of my closest friends who hold me accountable to when I say I will do something, I will actually get it done.
Sweta, it must have been such an emotional journey, to say the least. What has been the most defining moment of your life?
One of the early defining moments was when my son was born. So I don't know if you know, but I came to US right after my high school, and I did my undergrad in computer science from University of Maryland. Ishan was really young when I started working with PricewaterhouseCoopers, and we would travel with him quite a bit, but then eventually he needed to go to school. He couldn't really be traveling with me on every client site every few months or so, and my husband was also traveling at that point. My mom, of course, came to my rescue, and she helped me as long as she could. but then I needed to put my roots down, and I needed to settle. And that's when I was also thinking about switching to academia and pursuing a PhD, because that's when the Hosey King case happened and the IOM report first came out. And that to me was one of the most defining moments, because if all of those things didn't converge together at the right time, I probably would have continued on the path of management consulting. Who knows where that would have taken me? And being in a corporate sector is rewarding in its own way, but coming to academia and being able to launch the program and being able to have an impact on digital health, being able to be part of the journey. And there are very few times in your career where you can see a wave rise, and Kashmira will agree that health tech right now is on the rise, and it's not going to go anywhere anytime soon. It's only going to become more and more central. And for me to be able to play a role as the wave was rising, and to be able to support it, to see the growth of the city that I love so much, to be able to support the people who I've held their hands and gotten them through some of the toughest positions in their career, and through juggling academia, trying to juggle a full-time work and maybe having a life outside of that, and seeing them succeed and getting them into C-suite roles, some of them into board positions and the others. Those are the defining moments that keep me going.
Kashmira, you were with CDC during the COVID-19 period, and you were actually a part of their COVID-19 response team. What did it feel to experience those tough times, and what was your role during the pandemic?
In terms of my role, so I was actually the team lead for our epidemiology and surveillance task force team within the international overall response. So that means what I was responsible for doing is collecting information from all of the different countries, from the World Health Organization, from all of these different public health agencies, like how we have the CDC, there is the Public Health Agency of Canada, of the UK, and so coordinating between all of these public health agencies to understand what is going on with the pandemic, how many cases, how many, what is being tested, what are the patterns, are there things that now we are seeing in different countries, do they apply to the US? How can we do some predictive modeling to see what was happening? Is it going to be the same? Is it going to be different? And if it is different, then why would it be different? At the same time, we were in a very different administration at that point in time, where the CDC was, it was just a very different construct of where we were. And so I think that it was definitely unprecedented is really the word that I can think of, and just to try to keep up with everything that's going on, and to make sure that the messages are grounded in science, but at the same time we are very clear about what we know and what we don't know, and the fact that when we know stuff, we will be able to make those changes in recommendations. So it was a hard place to be in, but I think we've learned a lot from that experience and have really, really grown. I personally have, for sure.
I'm sure the whole world has grown into a different place after the pandemic. But I can't thank you enough, ladies. Sweta and Kashmira, thanks so much for coming and talking to us and giving some great messages out there to the women and girls who want to follow the STEM route. It's been a pleasure and an honor to have you on our TheShreeChannel. Thank you so much, ladies.
Thank you. This is great. This is awesome.
Yes.
Thank you for the opportunity.
So much for having us.
Thank you, Sweta and Kashmira, for coming to TheShreeChannel and telling us all about your wonderful journey. Hopefully, everybody out there feels empowered just like I felt today, and such great messages. Thank you so much for coming.
Thank you for the opportunity. Thank you.
Thank you for having us.